Welcome to the deep dive. We're here to cut through the noise and get straight to the really crucial insights you need. Today, we're jumping into some essential pharmacy concepts, looking at specific medications, the ones that have a big impact. We want you to walk away knowing the critical stuff.
Absolutely. And it's not just like what a drug does, but understanding those unique things about it, the implications that really make a difference in using them safely and well.
Okay, let's unpack this. First up, a term you might hear, peak and trough levels. Sounds technical, maybe, but when we talk about it here, we mean specifically antibiotic drug levels, like how high and how low the drug concentration gets in your body.
And why we track these is, well, it's fundamental. They're absolutely crucial for monitoring therapeutic ranges. You need enough drug, right, to fight the infection effectively, but critically not too much.
Right, that sweet spot.
Exactly. And that not too much part is key for preventing toxicity. Too high, and the medicine itself can cause harm. So checking these levels, usually just a blood test, it's pretty common when dealing with certain infections.
So if it's so critical for monitoring,
Yeah.
what actually happens if those levels, the peak and trough, aren't managed right? Like worst case.
That's a really good question. If the peak, the highest level, isn't high enough, well, the infection might not get treated properly. You could end up with treatment failure, being sick longer, or even worse, helping bacteria become resistant to the drug.
Okay, that's bad. And the other side, too high.
Right. If the trough, the lowest level before the next dose, stays too high, it means the drug isn't clearing out like it should. It builds up. And that's where you risk toxicity damaging organs.
Yeah.
Like the kidneys or even your hearing sometimes. It really underlines that just right idea in medicine.
Precision.
Yep.
Makes sense. Okay, let's switch gears. From precise measurements to something maybe more familiar, off the shelf even. Famotidine or Pepcid. What's the story there beyond just it helps my heartburn?
Right. Well, famotidine is what we call a histamine receptor blocker, specifically an H2 blocker. Basically, it blocks one of the signals telling your stomach to produce acid.
Simple enough. So how does that help someone with, say, GERD?
Its main job is pretty straightforward, but very effective. It reduces gastric secretions, less acid, and by doing that, it helps promote healing in the stomach lining or the esophagus. So yeah, great for things like GERD, that chronic heartburn, and PUD, peptic ulcer disease, those painful sores. It really just calms things down by tackling the excess acid.
Got it. Okay, speaking of distinctive medications, there's one that definitely leaves an impression. Phenazopyridine. You might know it as Pyridium. It's a UTI analgesic. So purely for pain relief from that awful burning feeling with a urinary tract infection, often given with an antibiotic.
And what's absolutely fascinating here, and so important, is this distinction. Pyridium is not an antibiotic. Big point.
Okay, that's key.
Crucial. It only treats the symptoms, the pain and irritation. It provides comfort, which is great, but it does zero, absolutely nothing, to fight the actual infection. You must still take the antibiotic prescribed to clear things up.
Good clarification. And then there's the unforgettable part, right? The color.
Oh, yes.
If you take this, it is completely normal for phenazopyridine to turn your body fluids, especially urine, bright red and orange, like fiery orange. And you do not need to report this. It's expected. Benign. I've heard people use the pyro and pyridium to remember the fire color.
That's actually a pretty good mnemonic.
Yeah.
And it really highlights how vital patient education is, doesn't it?
Yeah.
Like, imagine not being told that.
Exactly. And practically speaking, because of that intense color,
Yeah.
well, advice is usually to wear sanitary pads. And if you wear contacts, use glasses instead, because it will stain underwear, clothes, bedding.
Oh, yeah.
And it can permanently stain soft contact lenses. It's a potent dye.
Definitely. You don't want orange contacts permanently. So, clear warnings, save a lot of hassle, and, frankly, laundry.
But, okay, while that fiery orange is normal, a color change that's a huge red flag, or rather, a yellow flag.
Right. This is the critical part.
Nurses and patients, too, need to watch for signs of liver toxicity, specifically yellow skin and sclera, the whites of the eyes turning yellow. That's jaundice. And that must be reported to a doctor right away. Very different yellow.
So it's not just any color change. It's recognizing which color means trouble. If someone sees that jaundice, what should they do immediately? Why is it so urgent?
Stop the medication, call the doctor, or get medical help immediately. It's urgent because jaundice means the liver isn't working right. It could be serious liver injury developing, so you need to act fast to figure out what's going on and prevent further damage.
Exactly. Differentiating the expected harmless side effect from the dangerous warning sign. It's a common theme. Really dramatic effects aren't always bad, but you have to know which ones are.
That fiery orange is memorable for sure. Okay, let's move to another medication that can cause a similar color change, but in a much different context. Rifampin. This one's serious business. It's one of the 4 main oral meds used in the first 2 months to treat active tuberculosis, or TB. Then it's often continued, usually just with isoniazid, for another 4 months or so.
And with rifampin, patient education is just packed with vital points. First off, a really big one. Potential non-hormonal contraception interference. It can make birth control pills, patches, rings less effective. That's huge for family planning. Requires backup methods.
Wow, okay, that's critical info. What else should patients be watching for? What symptoms need immediate reporting?
They need to know the warning signs. Things like fever, losing your appetite, malaise, just feeling generally unwell, rundown nausea, vomiting, dark urine, or again, that yellowing of the eyes or skin. All potential signs the liver is struggling.
So liver monitoring is key here too.
Definitely. And because of that liver risk, patients should absolutely avoid alcohol while taking it. Adds more stress to the liver. And maybe the most important message, completing the full course of therapy. TB treatment takes months, sometimes longer. You have to finish it all to cure the infection and prevent resistant strains. No stopping early.
And didn't you say it also causes a color change, like peridium?
Yes, exactly. Connects back nicely. Rifampin can also turn body fluids, urine, yes, but also tears, sweat, that distinctive red-orange color. And here's a detail sometimes missed. It can permanently stain contact lenses, just like peridium could. Soft contacts especially.
Okay.
So again, clear communication is vital. You don't want someone thinking they're, crying blood because they weren't told about red-orange tears.
Okay, managing expectations again. And sticking with TB, let's talk about isoniazid, usually called INH, another key player. It has a dual role, right? Part of that 4-drug combo for active TB, but also used alone for prophylaxis.
Exactly. Prophylaxis means preventing active TB in people exposed or at high risk. Now, the durations differ. For active TB, INH is usually part of that combo treatment for 6 to 9 months. For prophylaxis, just preventing it, it's often taken alone for longer, typically 9 to 12 months. And one specific note, if someone also has HIV, their TB treatment, including INH, generally extends to the full 9 months because their immune system needs more help.
Okay, long treatment times. Are there specific things to watch out for when giving INH? Certain patients who need extra care?
Yes, definitely. You need to use INH with caution in patients who are known slow acetylators.
Slow acetylators, what's that?
It's a genetic thing. Their bodies process certain drugs, like INH, more slowly. So the drug hangs around longer, increasing the risk of side effects. Also need caution with people who are malnourished, have diabetes, or an alcohol use disorder. These groups have a higher risk of peripheral neuropathy.
Nerve damage.
Yeah, nerve damage can cause pain, tingling, numbness, usually in the hands and feet. So you have to monitor for that carefully.
That really highlights the need for close watching. And I assume compliance is just as critical as with rifampin.
Absolutely, non-negotiable. Full compliance is vital. Months, maybe a year or more of treatment, but you have to stick with it. Also, a practical tip. Oral INH should not be given with food. Food can mess with how well it's absorbed, its mechanism. It stops the TB bacteria from building their protective cell walls, basically dismantles them. It's bactericidal, kills the bacteria.
So, wrapping this up, what's the big takeaway here? We've gone from antibiotic levels to fiery orange urine to the long haul of TB treatment. Understanding these details, the expected side effects, the critical warning signs, how to take the meds correctly is all key, isn't it? Helps you navigate your health info much more effectively.
Totally. It's about being empowered, knowing what's normal, what's actually a worry, how these things work, and connecting this to the bigger picture. Think about how knowing these kinds of pharmacological insights, these specific quirks and warnings, might help you. How can recognizing these details help you ask better questions, whether it's about your own health or maybe someone you care for? How does it help you be a more active, informed partner in healthcare decisions, maybe even catching something important, something to think about?